If a tick bite happens today, you have just 72 hours to cut your risk of Lyme. Here's what to watch for: the truth about co-infections and the natural steps that actually help. Welcome to the Discover Health podcast, where we explore the power of gut health, nutrition, and lifestyle to help you feel your best every day. I'm Dr. Josh Sharp, your guide on this journey to better digestion, more energy, and overall well-being. Each week, we'll dive into expert insights, practical tips, and real-life strategies to help you discover health. Ready to start discovering? Let's hit the trail. Welcome back to another episode of Discover Health Podcast. I'm your host, Dr. Joshua Sharp, and today we're starting a new series on Lyme disease. We're going to talk about clear, practical, and hope-filled steps that you can take to protect yourself and your family. So you'll learn what Lyme is, how it spreads, why testing can be confusing and sometimes unreliable, what co-infections are and what co-infections to consider, and the natural tools that can actually reduce your risk. So let's start with what Lyme actually is. Lyme disease is a tick-borne infection, and it's mainly caused by something called Borrelia burgdorferi in the United States. It was first recognized near Lyme, Connecticut, and the bacterium was identified in the early 1980s. Lyme can affect the skin, the joints, the nervous system, and sometimes even the heart. It doesn't always show up and present itself in the classic textbook fashion. Normally, we expect to see things that we hear about all the time, such as a bullseye rash, a rash that is kind of round. It has kind of a bullseye presentation with a darker patch, and it expands from there, a bullseye type rash. But I'm here to tell you that that rash does not always show up. And sometimes it may show up, come and go, and it may be missed altogether. So I've had plenty of clients, plenty of patients over the years that had Lyme disease where there was no rash whatsoever. And because of that, it was missed early on when it could have been dealt with more simply, and they could have had a bigger and more profound effect right away. And so that rash is not something to hang your hat on. It's not something that you can count on all the time. How common is Lyme disease? Well, Lyme disease risk seems to be the highest in the northeastern United States or the upper Midwest, and there's cases in parts of the West as well. And in many cases, I've seen practitioners in the state of Missouri, where I live, almost act like it doesn't exist and there is no such thing in the Midwest. However, I have found that to be completely untrue, having treated many different patients over the years with Lyme co-infections. It's alive and well in Missouri, in the Midwest. And so the bottom line here is your exposure risk does go up in certain areas depending on where you live, but just because you live in the South, just because you live in the Northwest, doesn't mean that you're not at risk, because it is traveling and spreading all over the country. So depending on where you live, where you hike, where you spend time, your risk may be higher, but just because you don't live in the Northeast, just because you don't live in the upper Midwest, doesn't mean that you're not at risk. Let's talk about transmission. How can you get Lyme disease? How does it spread? Well, there's some facts and there's some myths out there. So most often we'll think of Lyme as spreading through the bite of black-legged ticks, ixoid ticks. These ticks can be brought in by pets. So you personally don't have to go outside in the woods and roam around and get a tick yourself. Your pets, God love them, as great as they are, can actually bring those ticks indoors, and it's easy to get a tick bite or technically a tick sting, but I like to call it a tick bite, from just a tick that rides in on your dog or your cat from outside. Pregnancy is actually a way that it can be transmitted. So from mother to child, that possibility is definitely there. The CDC states that that's rare, that it happens in rare cases. But I've seen cases, and I do believe that my wife and daughter were both impacted by Lyme disease, and the most likely scenario was that it was passed from my wife to my daughter. Now, what are some myths? Well, we don't have any confirmation, although there is some anecdotal evidence that could suggest that Lyme disease could be spread by mosquitoes, but there's no confirmation of that. So we're just going to focus and say that it is spread purely by ticks, and it is spread from mother to child, possibly. Now, other evidence out there suggests that it's possibly spread through sexual transmission, but we don't have any confirmation. We don't have any case studies that support that being a fact yet, that is spread through sexual transmission. And so it's possible, but we don't have any confirmed factual evidence to support that. So we're not going to say that's a confirmed thing yet. We're going to call that a myth. And we'll also bust the myth that Lyme disease can be spread through casual contact, through food transmission, or by water. Those don't seem to be likely methods of transmission. So we're going to think of Lyme for our purposes as only spread through ixoid ticks, or only spread through ticks. So what is Lyme when it happens to the body? What's it doing to the body? What's going on there? Well, the main form of Lyme disease is a spirochete form, and these spirochetes can spread from the skin to the joints, to the nerves, and unfortunately to the heart. And so they're really good at hiding from the immune system. I almost think of the spirochete almost like in the shape of a corkscrew. And I almost like to think of Lyme, that pathogen, as being able to burrow or screw its way into the cells, into the tissues, to kind of hide from your immune system and your immune cells. So this can make it really difficult for your body to get at and to actually attack and get rid of. So symptoms are often driven by the inflammation that bug causes. It causes lots and lots of inflammation. The organism itself is a problem, but more so when it damages the tissue that it's in, when it starts triggering inflammation of that tissue. That's where a lot of the symptoms actually come from, not necessarily the bug, but from the inflammation that bug is causing. So how do flares or up and down days look for real people? Because usually what's characteristic with Lyme is they'll have periods where they feel half decent, pretty good, and then that'll be followed by flare-ups and periods of time where they feel really bad, low energy, joint inflammation, aches and pains, headaches, things like that. So how does that actually look in real life? Well, the symptoms occur by stages. And so often early on, when this first contracted, there's a rash, but not always in the bullseye, but usually there's a red kind of a rash. Oftentimes there's a fever, but not always. And then there can be a time period where the person has fatigue. Maybe they feel run down, they feel extra tired, maybe they feel like they can't get enough sleep. And then frequently there are headaches that go along with this condition as well. Now, if that spreads, so after the first 72 hours or so, if that spreads, then you can get multiple rashes. The rash can spread. It can be different places in the body. You can actually get facial palsy. There's some evidence to suggest that some people are misdiagnosed with Bell's palsy, which is kind of like a palsy of the nerve in the face, makes the face kind of droop on one side, on one half. It can be really scary. It almost looks like a stroke partially, even though it could be caused, in fact, by the Lyme itself. People can get neck stiffness or meningitis-like symptoms. So the neck gets really, really stiff, really, really tight. It's hard to turn. It's hard to move your head. and they can almost get like a fever-like feeling, really, really warm in the neck. So sometimes these people are seeking chiropractic care. Sometimes these people are going to their healthcare provider with, quote unquote, neck spasms, and they're prescribed muscle relaxers. But really, at the root of it, it is Lyme. Now, something that's not talked about often is Lyme carditis, or basically inflammation of the heart, inflammation of the tissue around the heart that can come with Lyme. It can cause heart block or heart palpitations, so abnormal heartbeats, and a lot of times chest pain. So frequently, these people will get spontaneous chest pain, they'll get inflammation. Sometimes it feels like their rib tissue or rib cartilage is inflamed or irritated or hot to touch. Now, as this condition persists, as it's been there for weeks and weeks, maybe months, there can be intermittent or persistent arthritis. So this would be inflammation of joints. Sometimes it travels around. Sometimes it'll move from the knee, which is a really, really common spot, to the next day, or some other time it might be the shoulder, and then it might be the wrist. I see lots and lots, just personally in my practice, I saw lots and lots of wrist pain, chronic wrist pain, along with knee pain that really, really accompanied that chronic Lyme, people that were struggling with Lyme. There's sometimes nerve pain. Sometimes they'll have like a neuralgia, like just a shooting kind of aching pain, sometimes in different nerves. Sometimes it shows up almost like carpal tunnel, or it can show up almost like a sciatica, depending on the nerve or the location that of that pain. Sometimes people will get cognitive symptoms. They'll get what we like to call brain fog. They'll be very forgetful. They will have difficulty pronouncing words. They'll have difficulty remembering very, very simple things. You walk into a room and you go there for a specific purpose, and then as soon as you cross the threshold of the door, you forget why you walked into the room. Things like that. They'll have difficulty coming up with kids' names, so it's not uncommon for people to even forget their spouse's name, their kid's name, whenever they're put on the spot. That is a sign of what I like to call brain fog, but that can be a cognitive symptom that goes along with the inflammation that can be caused by Lyme. Now, migrating joint pain is something that we've talked about already, but sometimes people will get pain where there's lots and lots of cartilage or connective tissue. Some practitioners will say things like, well, Lyme loves cartilage. And I've found that sometimes, yes, they'll have very, very tender areas in their chest, the area between the ribs where you have lots and lots of cartilage. And so you might call this, costochondritis, something like that. But it's not necessarily a hallmark. Not every person that has Lyme has that costochondritis. And definitely not everyone that has Lyme has carditis. If you do have the, costochondritis or the inflammation, it could be really, really important to go get checked out by your provider to see if you do have carditis or pericarditis, which would be the inflammation of the tissue around the heart. That could potentially be pretty dangerous. So before we go on too much farther, let's do a quick self check. I've put together a few questions. It's just going to take a minute or so. And these quick questions, they're just yes or no questions that you can ask yourself that can help identify your risk for potentially having Lyme disease or chronic Lyme. So again, just a few questions here, 10 of them. Just count your yeses. So just answer yes or no to yourself and count these to yourself. So question 1, in the last few years, have you spent time in tick-heavy areas? Or have you had outdoor pets that could bring ticks inside? So yes or no. Question 2, have you removed a tick or had an unexplained, quote unquote, summer flu within 6 weeks of outdoor exposure? So the interesting thing is, a lot of times we just assume that the tick is there and then immediately we'll get sick, but it actually can take a while for that bug to spread, for it to multiply, for it to create that quote unquote flu-like symptom or create that fever. So have you had a summer, quote unquote, summer flu that's unexplained within the last 6 weeks of outdoor exposure. Question 3, have you ever noticed an expanding rash, even if it wasn't a quote unquote bullseye or perfect bullseye shape? Yes or no? Question 4, do you get migrating joint pain, especially in the knees, knees 1 week, shoulders or wrists in other weeks? Yes or no on that. Question 5, do you wake up with foot or Achilles pain that eases as you move? So you wake up, you get pain in your foot or in the back of your ankle there on your Achilles tendon, and it seems to get better as you move. Does that happen to you? Yes or no? Question 6, do you have drenching night sweats or a sense of air hunger or shortness of breath while at rest? Question 7, have you had facial palsy or have you seen new dizziness or palpitations or quote unquote POTS-like spells? POTS is P-O-T-S, POTS-like spells since a suspected tick exposure. Question 8, during a febrile illness, so an illness with a fever, has blood work ever shown low white blood cells or low platelets or elevated liver enzymes? Yes or no? Do you experience brain fog, word finding trouble, or memory slips that come and go? And then question 10, do your symptoms tend to flare in cycles or after exertion, especially in the heat, then partially settle down? So oftentimes, would you say that your symptoms get worse with heat exposure or exertion and then kind of get better or settle down a little bit? So if you said yes to several of these questions in a couple different areas, maybe the exposure, musculoskeletal questions, or the neurologic questions, or the systemic questions, it might be a good idea for you to take my free quiz that's called Could It Be Lyme? And this quiz can help give you a more clear score, and it can also help give you some next step guidance if you think that this could be you. I'll leave a link to this quiz in the description of this video, and you'll take that quiz and you'll get your score pretty much right away after taking that quiz, and it can give you a clue if this could be something you need to look more into. It doesn't give you a diagnosis. You'll just get a simple score and next steps that you can discuss with your clinician or healthcare practitioner. Again, it's not a diagnosis, just a starting point to help you get real help faster, because time is of the essence with conditions like this. If you want a simple way to organize your symptoms and figure this out, then grab my free Could It Be Lyme quiz in the description or in the show notes below this episode. So diagnosing Lyme disease, it can be really tricky. And here's why. So if the classic rash is present, Lyme could be a clinical diagnosis without any labs. They may not need any labs. They may not want to do any labs because it may not be worth the wait, because time is of the essence. And if it takes a week, if it takes 2 weeks to get the lab ordered, to get the lab drawn, to get the results, that's a precious, precious time that you're missing out on when you could be treating. So sometimes different clinicians, different doctors will just use symptoms. Sometimes they'll just use the clue of, okay, yes, we have a confirmed tick bite. Yes, we have a rash. Let's just go ahead and treat, trying to prevent a bigger issue on down the road. So oftentimes there's 2 steps in traditional testing. There's EIA and ELISA or ELISA. They'll do those tests first, and then they'll do a confirmatory test like an immunoblot or something like that, or sometimes a modified 2-tier approach using 2 EIA tests. And so these can be valuable, and they can really help provide some clarity when it comes to diagnosing this condition. However, depending on what's going on in your body when the test is performed, it's not uncommon at all for those tests to show up negative. I've heard some practitioners say things like, The test is only accurate 30% of the time. I don't know if that's true or not, but I've heard some practitioners say it's completely unreliable. I don't know that that's true or not. But when you're basing a test on antibodies, these antibodies take time to develop, and sometimes antibodies persist. They can linger on for years and years. So a positive test doesn't always mean that it's positive for an active infection, and a negative test definitely doesn't mean that there is no infection at all. It just means that you have a negative test. So it's always best to correlate with clinical data. How's the patient presenting? What's actually going on? What's their history? What are their symptoms? And it's always best to correlate with some other factors as well, risk factors, to really determine if that person is at high risk and to determine next steps. And so there are some alternative tests out there that haven't been quote unquote validated, but those tests sometimes can be useful. I do know there are some Lyme practitioners around the country that don't rely on lab tests because they can be very, very expensive. And unfortunately, clinically, these practitioners have found the lab testing isn't very accurate. And so if it's expensive and not super accurate, then sometimes the question you have to ask is it really worth it? So I do know of some practitioners out there that will diagnose based on symptoms alone. And I do remember hearing from one practitioner in the past, a very, very prominent practitioner treating Lyme on the East Coast. And at the time that I heard him present, he was doing a lot of diagnosis simply based on questions and interview and history, even over the phone. And so he was working on developing some more detailed questionnaires and quizzes and things like that to really help make his diagnosis, to try to make sure that he wasn't solely relying on lab testing. Lab testing definitely has value if done at the right time and the right way. But you do have to keep in mind that a positive lab test doesn't always mean it's truly positive, and a negative doesn't always mean that it's truly negative. You have to be thinking about what's going on at the time of testing, the retesting, and see if you can explain if you have a negative test, could be a false negative, and could there be a way that you could reconcile that and get proof that it is negative, or proof that it unfortunately wasn't accurate. So what about co-infections? What are things about co-infections that you should know about? Well, one tick bite, it doesn't just necessarily transmit one pathogen or one bug. It can transmit more than one pathogen. And that's what we call a co-infection. We essentially think of it like Lyme and all of his buddies. They might come along and join the party. A common one that goes along with Lyme very often is something called Babesia microti. There might be some other names for that as well, other variants or other strains, but this is a malaria-like, really small single cell parasite. And it's a malaria-like parasite. And it loves to get inside of and consume and damage red blood cells. And if it can get into those blood cells, then that bug can really travel anywhere that those blood cells travel in your body. Oftentimes, this can cause symptoms like fever, like sweats, like fatigue, or anemia. Anemia can be having too few blood cells. It can be having damaged blood cells or malformed blood cells. And so it really can affect your energy levels, fatigue. It can throw off some weird symptoms that go with poor circulation. Even though the person might appear healthy, might appear young, they might appear fit, they don't have any classic signs of having poor circulation, that can sometimes be caused by Babesia. And importantly, it doesn't respond to normal antibiotic medication. Remember, it's not a bacteria, it's actually a parasite. And so that type of condition, or that co-infection, can go right along with Lyme. Another one is Anaplasma. And this one can cause fever, headaches, muscle aches, and it often shows up as low white blood cells, low platelets, and sometimes elevated liver enzymes. And liver enzymes will be elevated whenever there's some damage happening in your liver. Another example of a co-infection would be another type of Borrelia miyamotoi or miyamotoi. I'm not sure how to pronounce that properly. I've only read about it, but it can cause a relapsing fever, high fevers that can come and go. Sometimes it can also cause neurologic symptoms. And then there's some viruses that can come along with Lyme as well, things that can cause encephalitis or meningitis, so inflammation of the coating around your brain. It can cause inflammation of your meninges, the coating around your spinal cord, and antibiotics also won't really help those issues as well. So if someone is treated early for Lyme, but that fever persists beyond a day or two while they're on antibiotics, then it's a good idea to think about the possibility of Babesia or consider Anaplasma as a cause for those fevers. So if someone has Lyme, classically, what are the common treatments that are used and how effective are those treatments? Well, for early disease, if it's caught early, antibiotics are the most common thing that's used, something like doxycycline, amoxicillin. There's some other ones that are commonly used. And I've heard varying reports on the effectiveness of this, but I would say that it seems like, from what I can find in the data, that if you catch it early in the first couple weeks, this probably is your best chance of avoiding some chronic Lyme. Now, is it true? Yes, there's some collateral damage when you take antibiotics. Sure, you do lose out on some good bacteria. You do run the risk of side effects using medications like that, but it could be something where you just need to weigh the pros and the cons, weigh the benefits and the risks before you decide what type of treatment that you're going to do. Duration can vary depending on the manifestation, depending on your physician, depending on how they're deciding to treat it. But the duration of that treatment may vary from a couple weeks to longer term treatments. There are certain neurologic, cardiac, or arthritis cases that may need to be tailored based on those symptoms. They may change the length, and sometimes they might do more significant therapy like an IV therapy. Some people have ongoing fatigue, ongoing pain, or brain fog after the normal therapy, after the standard therapy. And often they would call it, oh, this is the lingering Lyme or post-treatment Lyme symptoms. So they've had treatment, but they still have symptoms lingering. So multiple trials in the research don't really show added benefit from prolonged or repeated use of IV antibiotics. So care probably should be focused on symptom-directed recovery and sleep, nervous system regulating, monitoring mood changes, monitoring cognitive symptoms and pain strategies. And this is where the research really doesn't have tons of great data because there's so many different strategies out there. There's so many different techniques to try to help those people that have post-treatment symptoms, people that have chronic Lyme symptoms, because the effectiveness of the antibiotics seems to go way, way down. The research doesn't show a lot of great results in managing those symptoms after those first few weeks. So those strategies can really vary. And I can walk you through my wife and I and our story with Lyme. And I'm going to do that in the next episode. We'll talk about what she experienced, what things that she tried, what she went through. And then in our final episode of this series, we'll talk about the approach and the exact steps that we found that made the biggest difference for her and so many other people. We don't treat Lyme. We don't treat Lyme disease. That's not in our scope. Our job is to try to remove obstacles, to find barriers that prevent healing, that prevent normal body function, to support the body in its attempt to heal itself and to support the body in its attempt to regulate itself. That's where we come in. Our job isn't to treat Lyme. Our job isn't to treat bacterial infections or anything like that. Our job is just to support the body and provide a really supportive and healthy environment and trust that the body can heal itself when you remove those obstacles that stand in the way. Depending on your situation, your approach to treating it, your approach to recovery might look really, really different. So there are quite a few natural options out there, and there's some practical prevention steps that you can take. So there's some promise seen with botanicals taken early on. So people often ask about herbs like cryptolepis. In lab studies, cryptolepis has shown some effectiveness against Lyme bacteria and against Babesia, actually. Other herbs with lab signals include things like Japanese knotweed, Scutellaria, black walnut, Artemisia annua. And so these are some options as well that are natural, that are out there, that have shown some promise in helping people with this condition. However, they're not without risk as well. You definitely want to avoid taking those things during pregnancy. You want to make sure that there's no interactions with medications that you might be on or other substances that you might be over the counter substances that you might be taking as well. And you only want to use those things when you're working with a knowledgeable clinician who can guide you and support you along your journey. Personally, we have used these things to support people with these conditions in the past. We love to use botanicals and natural means to support mitochondrial function, to support energy production, to support detoxification, to support healthy immune function, things like that. And we have seen a lot of positive changes in symptoms of people with Lyme disease and other Lyme-related issues, co-infections, and things like that in the past. And I will definitely walk you through the things that really helped and made a difference with my wife, who was struggling with severe chronic Lyme and extreme fatigue from that condition. We'll walk you through those things in a future episode. So, what else do you need to know about Lyme disease? Well, if you find a tick on yourself, how do you safely remove that tick and reduce your risk of contracting Lyme disease from that tick? I would highly recommend that you use really fine-tipped tweezers. What you want to do is grasp the tick as close to the head, as close to the skin as possible. So really, really make sure you're getting down as close to the skin as possible. You're going to pinch gently, trying to direct most all of your pressure towards the head, towards the front end of that tick, and then you're going to pull straight up with steady pressure. You want to clean the area afterwards with alcohol, with hydrogen peroxide, and even with soap and water. Things to not do. You definitely don't want to use essential oils. You don't want to use nail polish. You don't want to use heat, and you don't want to squeeze the body. What can happen is when you squeeze the body, or when you use things like nail polish, or when you use oils, it can actually cause the tick to puke or to vomit or to regurgitate. And that's exactly what we don't want. We don't want whatever's in that tick to be pushed into your body. If the mouth parts of the tick actually remain after you've pulled it out, leave them there. Your skin will actually usually push it out on its own. If you're concerned that the tick might be a tick that carries Lyme, you can save the tick in a plastic bag, or you can save it in like a little container with a bit of alcohol in it to kind of preserve it. You can take a photo of it to help you identify it if you need to do that, but don't necessarily rely on tick testing to determine your treatment. So what are some steps that you can take at home in your yard to reduce your risk of Lyme, reduce the presence of ticks? Well, the number one thing is actually make it hot, make it bright and dry. So if you've got a lot of leaves that kind of hold moisture under the ground, if you've got a lot of brush, if you've got a lot of shade that keeps high levels of moisture, that reduces sunlight, this can actually increase the risk of ticks in your yard. When you have a leaf littered and brushy area, that's where ticks love to live. So one thing you can do to help yourself is mow frequently. Another thing that you can do is almost create a little barrier or a 3-foot border of wood chips or gravel, things like that, between the woods, like where you want nature to stay, and between your play areas or your yard. These bugs don't necessarily like to cross over that border. And so giving yourself a 3-foot boundary area around your yard or around play areas or high traffic areas using wood chips or gravel can be very, very helpful. Moving play sets and patios into the sun, if there's a brushy area or lots of shade where you're close to a brushy area, moving those areas where they can get more sunlight can actually help reduce the risk of ticks in those areas. Firewood is often an area where ticks love to live, so try to stack your firewood in areas where it can stay dry and also off the ground, elevated off the ground. If you have Japanese barberry, a plant, consider removing that. It can actually lower infected tick numbers just simply by getting rid of that plant that pests love to live in. I have seen some products in the past that use essential oil blends. They'll have a hose connector, and you can spray your yard to try to ward off ticks or to try to kill ticks and pests that might be living in your grass. I'm not 100% sure on their effectiveness. It's things that we've tried in the past. It seemed to work, but who knows how well those things work. But I have seen products that advertise just to be made out of essential oils. For those of you that don't want to put chemicals, I'm like that. I don't want to put chemicals in my yard. I don't want to put chemicals in places that we're going to be walking and potentially getting it on our skin, or our pets getting it on their skin. So I do know that there are some products out there that can be used to spray your yard to try to reduce the risk of ticks being in your yard, being in those high traffic areas. Now, what if you're going in the woods? What if you're someone that likes to hunt, that likes to take hikes in the woods? What are some ways that you can protect yourself? What are some ways that are effective? Well, you can look for EPA-registered plant-based repellents. These could be things like oil of lemon, eucalyptus. There's some other ones out there that might use some naturally occurring things, some oils from different plants that could be natural repellents. And so those can be good options to put on the clothing. One great way is to create a natural barrier. Wear long pants, wear long socks, tuck your pant legs into your socks. Not only will you look really cool, but you'll actually reduce the risk of a tick crawling up through your pant leg. Remember, they're not probably jumping off the trees. They're probably getting on you from brush. They wait there with their arms out for you to walk by, and then they grab hold as you walk by. So most of the time, they're coming from the bottom up. So putting your pant legs inside of your socks can be a good option to help reduce the chance that they're going to crawl up your pant legs from your shoes or from your socks. Another example would be tucking in your shirt. That just creates one more barrier for them to get on your skin, and so they would have to walk even farther up to reach your skin. Make sure that whenever you come in from outdoors that you take off your clothes, shake them off immediately, and it might be a good idea to rinse off or shower once you come in from walking in the woods or being in brushy areas. So if you remember just these 3 things from this episode, recognize early symptoms when you have them. Consider co-infections when the picture doesn't fit well, it doesn't meet the textbook definitions. And then use practical steps to help prevent or reduce your risks on your body, your clothes, and your yard. And if you want to dive deeper into your symptoms and some of the health issues that you've been having, then make sure you click the link and take my free quiz, Could It Be Lyme? It can help give you some more clarity if your symptoms could be related to Lyme or other chronic conditions that can be associated with Lyme. And then stay tuned for the next episode of Discover Health Podcast, where we are going to be telling our Lyme story. I'm going to interview my wife, Ginger, and share the things that we missed when we were going through it. We're going to share what finally helped, what actually helped her get well and start to get better. And we're going to share what we would do differently if we went through this again now, knowing what we now know. Thanks for listening to this episode of Discover Health Podcast. Have a great day. Thanks for tuning in to the Discover Health Podcast. Remember, your health is a journey, not a destination. Keep exploring, and we'll see you next week.